Okay, so this is part 2 of looking at this diagram. Okay, in the first video I did, we saw how and why we ended up with scar tissue right back here on the uterus behind the bladder. Now I'm going to talk about how this little bit of scar tissue here can cause some people issues. Okay, so because of its location on the uterus, some people might find that they get pain and discomfort actually on the uterus, for example when they're putting in tampons or with sexual intercourse. Okay, so that little bit of scar tissue can cause some tightness on the uterus wall. Okay, it can also migrate across a bit onto the bladder wall. Now if it does this, it's almost pinching on the side of the bladder. Okay, and this pinching effect can give a missed signal to the brain, and that missed signal is telling the brain that the bladder is full before it actually is. Okay, so we can end up with increased frequency of needing to pee, basically. Okay, the third thing that scar tissue in the area can cause is, so from the uterus we have these lovely ligaments which run all the way back here onto our sacrum. Okay, and these are important ligaments for keeping our pelvic organs in place. But if we get a bit of scar tissue, again compromising these ligaments, then they can compromise this joint here. So this is a joint called a sacroiliac joint. Some people might have heard of SIJ or sacroiliac pain, and issues with this ligament can cause this type of pain. So essentially pull on one side of the joint, okay, causing you one-sided lower back pain, just at the base of your back where your kind of bum meets the lower back. Okay, some people might find you got the two hard knobbly bits and they can be particularly tender. Okay, so these are all red flags of things that might be caused by scar tissue. Not always, but it's a good first port of call. Okay, now obviously with pain during intercourse or bladder issues, you want to speak to a GP as well, or women's health physio, but these might be things that you can do alongside or once you've exhausted everything else, or as I say, a first port of call. Okay, any questions, just let me know.